Secretary Robert Kennedy Jr. faced heated questions from senators on the Finance Committee. The main topics, of course, were the vaccine policy, how confusing it is at the moment, and all the upheaval at the Centers for Disease Control, including his firing of the CDC head, Susan Menarez. Several Democrats are calling for Kennedy to resign, and several Republicans had very pointed questions for him during this hearing. Kennedy is defending the changes at the CDC.
I'd like to address the recent shakeups at CDC. These changes were absolutely necessary adjustments to restore the agency to its role as the world's gold standard public health agency with the central mission of protecting Americans from infectious disease. CDC failed that responsibility miserably during COVID, when its disastrous and nonsensical policies destroyed small businesses, violated civil liberties, closed our schools, caused generational damage in doing so. And the people at CDC who oversaw that process, who put masks on our children, who closed our schools, are the people who will be leaving. And that's why we need bold, competent, and creative new leadership at CDC.
Senator Elizabeth Warren from Massachusetts was one of the Democrats who grilled the secretary over vaccine policy.
That all adults and all children over 6 months of age are eligible to get a COVID booster at their local pharmacy today.
Anybody can get the booster.
I'm sorry?
Anybody can get it, Senator.
Anybody. So you're saying that is now the official rule of HHS. Anybody is eligible to get a booster by just walking into the pharmacy.
It's not recommended for healthy people.
No. If you don't recommend, then the consequence of that in many states is that you can't walk into a pharmacy and get one. It means insurance companies don't have to cover the $200 or so cost. As Senator Dr. Cassidy said, you are effectively denying people vaccines.
We're not going to recommend a product for which there's no clinical data for that indication. Is that what I should be doing?
So this was interesting. Some of the Republicans on the committee also had questions and concerns about vaccines and access to them across the country. Senator Mike Crapo of Idaho, the chairman of the committee, brought up the president's so-called big, beautiful bill as well and its impact on our healthcare system.
The attacks right now going on publicly about hospitals are in trouble. And the blame for that is placed on the bill, even though the bill hasn't even been implemented yet. The fact is this committee held hearings on the troubles that rural hospitals are facing in the United States before the passage of the One Big Beautiful Bill. They've been facing difficulties in rural America for a number of years now.
All right, we are joined by political consultant Joe Caiazzo for some analysis on this hearing and its impact. He's a partner at 1788 Media, a Democratic strategic consulting firm. He was also a senior staffer for Bernie Sanders' recent presidential campaigns. Joe, thanks so much for being here. So did Secretary Kennedy adequately answer the senator's concerns?
Well, let me start here. Thanks so much for having me this morning. It's really great to join the both of you. Look, I think Secretary Kennedy has been consistent his entire time. The peddling of an anti-science rhetoric and, pushing aside known science, known things that are going to be better for the American people. And it doubles down on the Trump administration, a constant attack on things that are absolutely critical for people to thrive in this country.
We've seen healthcare in the past used as a political football, thinking back to Obamacare and how much debate centered around that and also those COVID protocols. Is this more of the same or is this different somehow?
Look, this is different because in this case, the Republicans are in charge, and the Republicans have made a conscious decision to push a set of policies and a battery of sound bites that will ultimately lead to people in this country being less healthy and less safe.
Joe, look, you heard Senator Kennedy's position, which is that he thinks that the CDC mismanaged horribly COVID. And so when it was the global pandemic, he thinks that the kids got really the short end of the stick, that they didn't go to school, they missed out on it, set them back years, they shouldn't have been masked. I mean, you heard his argument there. So he is allowed to fire people that he say are leftovers from the previous administration. Why is there so much uproar over this?
Well, I think there's a couple of reasons. First of which, as the Secretary of HHS, he was unable to go and confirm the total deaths surrounding COVID, something that has been quantifiable. The other thing is, look, he just fired the head of the CDC, somebody who he sat next to, a couple of months ago, and called her unimpeachable.
Is there anything that you heard or see in the way of his reforms that you think Democrats can give him credit for, including maybe banning certain additives in processed foods from school lunches?
Look, I do think it's really important to take a look at the food supply in this country, but overall, the rhetoric peddled by him is incredibly dangerous. Look, it also goes and plays into the overall narrative of the Trump administration that is chiefly focused on tearing down the institutions that make this country great. We saw in the clip a little bit earlier some mention of the big ugly bill, for lack of a better term, and Senator Crapo go and reference the problems that various rural hospitals have gone and had all over the country. They're pushing legislation like the big ugly bill that's going to be responsible for increasing wait times at the VA. That's going to be responsible for the pretty quick closure of rural hospitals, and that's all coupled together with an anti-science rhetoric that will ultimately lead to people becoming sick and in some cases cause death.
Joe, I know that you're a Democratic strategist, but what did you think of some of the Republicans who pushed back? I mean, primarily these are people who are the doctors themselves, which RFK Jr. is not. Do you think that there'll be any sort of Republican backlash or groundswell? I mean, as you know, generally they fall in line behind what President Trump wants.
I think you certainly will see some level of pushback. You have to remember that the Republican Party is controlled by the fringes of society now. These are people who are anti-science, anti-truth, and just will blindly fall in line behind the Trump and the Trump administration. I give Senator Cassidy a lot of credit for standing up and calling balls and strikes on Secretary Kennedy, who is unable to go and articulate a clear and thoughtful and cogent position on this. It sounds nothing more than the peddling of relentless sound bites.
Joe Caiazzo, thank you very much for your perspective on this. I think that Joe makes a good point in that there were some things that Secretary Kennedy either couldn't answer or didn't have the answers to, but primarily didn't want to. I mean, I felt like he's so skeptical that the numbers of government data that he now oversees, in other words, the research from the very agencies that he oversees, he's skeptical of much of their data. And that is confusing from somebody who heads these agencies.
It's confusing, and it calls into question, what do we rely on? If we can't rely on data from the government in terms of what the fatalities were and how effective the vaccines were, so where do we turn for credible information? As one sort of observer of a non-partisan health advocacy group said, I thought this was spot on. We don't need to burn down the house. We need to fix the plumbing when talking about what needs to be done about our nation's healthcare. Obviously, we have big issues when it comes to healthcare, chronic disease, big issues in our country, but are we going about it in the right way in terms of how we make our country healthy?
And I was glad that you asked him about, there are some things that Democrats, in fact, lots of Americans, certainly parents, are very happy about that RFK Jr. is doing in terms of the school lunches and the food, the additives in the food and the red dye number 2 and all of that stuff that it's good that he's looking at. However, there were some things, as certainly around COVID, that he seems quite skeptical that the COVID vaccine saved millions of lives. But we saw that with our own eyes when hospital room admissions were plummeting and how much, how fewer people died after the vaccine came out.
Yeah, I think we all have people we know of who got very, very sick during COVID. I have friends who lost, loved ones to COVID. And, we were in a time of, extreme fear and panic, and we did rely on the science. We relied on those vaccines to try to get us through that pandemic. It's a very confusing time, I think, for people understanding, okay, what do I do with all this confusing information that's coming from our federal government when it comes to healthcare?